Hi, welcome to yet another Inner Circle podcast from 18startup. Today we have a very interesting person, Dr. BV Srinidhi. He is a medicine director, laboratory medicine director, microbiologist, but is now interested in building a startup around his own domain. Welcome, Dr. Srinidhi.
Thank you, sir.
Yes. So you would have spent a lot of energy, effort, emotions in doing your medicine, then your PG, and building a career in the medicine field. So, what drives you to be an entrepreneur?
Innovation and meeting new people, networking, and mainly creativity and innovation drives me to be an entrepreneur. And especially in this AI generation, I find it can be of use in a different field, especially in healthcare. It is of much required, and a lot of gaps are there that need to be filled in healthcare. I
Hmm.
feel healthcare is the next emerging sector for AI. So I want to be a leader in that.
Okay, great, awesome. So, tell me something more about your early days of deciding to be an entrepreneur. I mean, you have a thriving practice. You already have, revenue source doing something. So, in the beginning, how did you decide that? Okay, what triggered that event of deciding to be an entrepreneur?
Actually, in 2014, when PM Modi launched Startup India, I saw some entrepreneurs being honored, especially like Practo, Oyo, and all.
Hmm.
And that is what sparked me. That time I didn't have a solid idea to start anything, but I was doing my practice, and at the in the background I was doing my research in medicine, and I was getting a strong foundation with my expertise. So
Hmm.
now, since 2024, AI is making news. ChatGPT came. I started using ChatGPT, and I saw some potentials and a lot of arenas opened for me, ideas opened for me, especially with healthcare. Before that, I was using Google for doing all this, but now AI has made it more simpler, and I want to make AI tools for making patients and doctors work simpler and easy to predict and personalize things.
Okay, so it's nearly some 12 years of
Well, yes.
bug that has been in your mind. Now A has enabled you to get into it. Good.
Yes. AI really has made my it has given me 10 hands and 10 brains, and I'm doing everything. I'm doing the video editing. I did few AI courses
Mm.
and data science course also I did before that, and I got an idea how coding is done and how data is analyzed and how to design the data and what. So then I correlated with the medicine data that is available, and how can we divide the data. So I got a mapping in my brain, so that's made my ideas more easier. And I'm my SWOT analysis, my weakness is one. I'm not little uh, like of entrepreneurial mindset. Slowly over a period of 1 year I have developed that, so now I am confident that I can enter the field in full force,
Mm.
like attending boot camps and all, networking with people, and
Okay.
mentoring has made me confident.
Great. Awesome. So, Srinidhi, can you talk a little bit about the venture that you are building? Tell us more about the
Uh,
people who benefit from it and the problem it will solve.
my venture is implementing AI in healthcare. As such, it's a broad array, though people tell you need to focus on one thing. But as you know, over a period of 12 years, I have a lot of ideas stuffed in mind, and slowly I'm executing one by one. And I have made two MVPs as of now, but now I have launched a course for engineers to train for healthcare data. So, 2 month cohort we have launched from our startup. And one more thing I want to update in podcast that I got a CTO and he is also from 18 startup community of previous batch.
Oh, awesome.
And
Who is that?
his name is Lalit, and
Lalit. Okay.
he's from Andhra, Nellore.
Mm,
And
mm,
we didn't know that we were part of 18 startup, but we saw in LinkedIn and online that we both are in the same community. Then he approached me for a position, so we both are working together to train college students in healthcare AI specifically because healthcare AI needs a lot of regulatory compliance and ethics to be followed. So me as a doctor, and I have one or two doctors who are trained in AI, and we are part of team. And I also want to bring some CEOs of other startups to be in this program and train young college students in healthcare because that is the next emerging market, and a lot of AI tools will be coming in AI.
okay. Awesome. Awesome. So let me know when the program is up. I'll also join. So I really want to learn these new things. ठीक है.
Sure.
So yeah, currently how big is your team? Yourself, Lalit, and anybody else is there?
I have my wife. She is also my co-founder. She is also a biomedical engineer,
Okay.
and I'm getting some intern uh, queries and also slowly I'm trying to build my team and this course the purpose of this course is to build a team so that my idea stays within me and uh, all the training they to continue as a community. That is what I am looking in longer.
So you want to spread the idea and make it larger through the community. Awesome.
The basic idea is like what I am planning is first I will train the engineers and also doctors. So with doctors and engineers, I will start making AI tools. I have whatever ideas like in pregnancy, what is the tool required for a pediatrician? What is the tool required for women's health? And also collaborate with other startups and do these tools like that. And also uh, extra. Well, I want to basically collaborate with other startups and spread my ideas and bring it to reality.
Hmm. So this whatever tools that you are building, they are all likely to help the doctors in diagnosis, is it?
Yes, doctors and patient. Say for example, right now I have made a tool for detecting the viral infections where basically what I want to say is everyone is chasing data sets uh, everywhere. But when it comes to healthcare, healthcare is like an accident. It doesn't depend on the previous data.
Mm-hmm.
So so it is the forthcoming prediction is what, and those inputs what is what matters to give an accurate prediction and to avoid hallucinations in AI. So this is what we are trying to do, and this virus infection is basically because of the host. I mean, the human person's genetic defect, the virus can become stronger. So this is what the expertise I studied over a period of 10 years and did a research. So, so I'm bringing that into reality so that the doctors can identify the severity and so that they can plan for ICU admission and treatment and
Mm-hmm.
also for the patient take preventive measures to get protected from the viral infection.
Okay. So basically,
So
what you're saying,
similarly,
what you're saying is with your tool, this one size fits all kind of medication will be stopped, or trial
yes,
and error kind of medication needs can be stopped based on the
yes.
genetic data and the virus. You will be able to predict a better prognosis.
Yes, and also with the same platform, we can upgrade it to a vaccine generation and personalized treatment,
Mm-hmm.
and also like quantum computing can be incorporated for this to analyze big data, as quantum computing is also emerging.
Hmm. Good. I think I mean it's a large vision, Srinidhi, and how are you preparing yourself? You already told that you are attending AI classes. You are also creating community. Do you have a strategy for taking this entire thing? Because whatever you have taken up, it looks like a very mammoth task, right? You are not trying to create any small product which can be sold repeatedly and some money can be made. So, what is your strategy for this?
I will collaborate with the hospitals who are having uh, like postgraduate medical students, and they will be doing thesis in their post graduation.
Mm-hmm.
So since these AI tools get should be certified as a software as a medical device, we can collaborate with medical colleges and other specialty hospitals with doctors to see and also certify the tool. So I want to
Mm-hmm.
talk to medical colleges and collaborate with them and try to do this and bring it to reality.
Okay, great. So, tell us something more about your life, Srinidhi. I mean, how did you land here? Where were you born, and how did the schooling and things like that go?
I was born in Tumkur in Karnataka, and I studied in Bangalore from Sheshadripuram school from
Mm.
first standard to 12th standard. Then I did my MBBS in Kolar, Sri Devarajaras Medical College, and my post graduation from CMC Vellore.
Okay,
And 1 year I was working in Chennai in
mm.
Vijaya Hospital, and then I came back to Vellore and working here in private practice.
Okay, good. And I mean, this entire journey, what do you think is your biggest achievement so far?
My biggest achievement is uh, to gain knowledge, and I have made a strong foundation. I feel my real life or project begins now. The
Okay.
next 2 or 3 decades have not. Uh, Achievement is that I have stayed in a good space and without much. And I have to able to implement my ideas right now. So it is good. So I see future with AI as of now.
Okay. So you don't consider anything an achievement yet, right? You
Not
are
yet.
saying that the next 3 decades is going to be the achievement.
Now,
Hmm.
even if I achieve also, I don't, I usually stay calm. Whatever happens, whether it
Yeah,
is good or bad, doesn't impact me. I will be in the same
yeah, I have seen that.
emotional.
Hmm. Good. So, is there anything that you want to share with the entrepreneurs? Meanwhile, I think before that, I would also want to know how 18 Startup has contributed to your journey, or how has it made it better or worse?
No, actually, I came with a blank idea to the boot camp in Kormangla, Drapers, a 4 day boot camp. Especially your talks, I think I will listen every time because I like your way of presenting. You make very simple and easily understandable. And from your experience, I learned a lot of things and how to handle, how the mentality of the CEO should be and how to handle things. And the total 4 day experience was very good. And I connected with a lot of people and it was good experience for me. And like overall, 18 startup faculty, Jay sir, Teja, everyone were handling things, and we became friends, and it was good experience those
Right.
4 days.
No, can you just tell me, okay, what changed in those 4 days? Is there anything new that you are doing now? compared to what you were doing before you came to the boot camp?
New is that it gave me a my mentality change. That itself is
Hmm.
what like I experienced. I know I know my healthcare journey in AI will be very slow process. It won't be very fast because
Hmm.
of a lot of regulatory approvals or anything. So I have prepared for that mentally. But
Hmm.
what I learned from Health 18 Startup Bootcamp is to how to think and how to implement an idea, how to prepare for an MVP, and how to present an MVP. Whether are we ready to present that MVP to the real market, and these are the things which I learned mainly,
Okay.
and the BlackBerry movie.
Yes. Awesome. Right. I think they have left us a great lesson, right? Hmm. Awesome, Srinidhi. So, is there anything that you want to tell aspiring entrepreneurs, especially doctors like yourself who are toying with an idea? I've seen a lot of doctors having this aspiration that, yeah, I want to do something. But at some point, they are already busy with their practice and things like that. They don't move forward to actually implement those ideas. So, is there anything that you want to tell your doctor friends about entrepreneurship journey?
Especially young passing doctors and medical students, I want to tell that uh, there is lot of gap other than hospitals and medical colleges. So majority of the young doctors of the mentality that I should complete NEET and I should get ready for a postgraduate studies and I need to join some hospital. But in the society, there is lot of gap and there are lot of opportunities out. You can explore. You can be a family doctor of your own area, and that itself is a niche market. And with AI, you can handle those patients as a family doctor and cater their basic needs daily and keep updated and educate them, not with only treatment. Preventive care is more important. We are in the mindset that only after disease comes we need to go to a doctor, but a disease can be prevented right before it comes. So that needs to be addressed to the public rather than treating them, and already the damage has happened. So I don't think once the damage has happened, our body will recover soon. So it's better to prevent than treat. So
Hmm.
preventive care is a big market. So you should focus on that, and that itself is a entrepreneurial market for young doctors.
Okay. So there's a
In
lot of
that,
potential.
we need to, yes, sir. And two emerging fields are there. One is genomics, and one is AI. So with the genomics, we can predict even before the disease occurs, and even with genomics, we can predict how the baby is born and how the pregnancy will be. And if we can make this plan a proper executed way, it will be a good, healthy generation can be made actually.
Okay. So, do you want to tell something about the name of your company?
My company is Ignos. I mean, the brand name is Ignos, AIGNOZ. So I have registered it as Ignos Healthcare Solutions, and my company is implementing AI and genomics. So why AI and genomics is the sense as as my 35 years of I'm a 35-year-old, and my 12 years of experience, I have been seeing that medicine is seen in a wrong way. If we see it in a right way, like using these AI and genomics tools, we can predict the disease before coming. Patient gets a disease by knowing the disease causes, disease progression. So we need to stage the disease right way. It's not like we need to study everything and present to the patient. We should sit to the patient and then go back retrospectively to what patient is facing and what the genetic data of the patient is and how AI can be used is what my vision is in my company, and that I will be implementing that to the doctors and patients.
Okay. So in some time in the future, if as soon as the baby is born, you will take the DNA details and or whenever. So from journey from the very young age, you can actually predict. Okay, you'll be telling the Kundli. Okay, next 4 years is going to be like this.
Yes,
At the age of 50, this guy is
yes,
going to face a problem. So have certain practices now itself so that he doesn't achieve that milestone.
yes. So the basic problem is these are not taught in medical colleges. Our syllabus is still not updated to present AI and genomics. So I'll be making some courses for this also with other doctors to training MBBS passed out. And my plan is to give these AI tools for the doctors to practice as a clinic in their maybe in their village or in their hometown, so that
Hmm.
they can use these tools and practice and make a decent income, better than a private hospital or a medical college also.
While still impacting the citizens in a better way than currently, right?
Yes. More
By the,
personalized. I feel the patients are coming to the hospitals in the end stage after the disease, after visiting multiple doctors in their locality, and a lot of wrong diagnosis and wrong treatment is happening because the data is not handled. So that is where AI will play a role in solving the correct, because patients don't have their data in their hands, and doctors also don't know, because patient will be jumping from one doctor to other because of different specialities, and that is where AI will play a role.
okay.
Like a general doctor can handle specialty uh, cases, like he can see diabetology also, only refer the necessary patients to the necessary centers. Like if some patient needs a bypass surgery, you can refer to a cardiologist.
Hmm. So this family doctor concept has actually it used to be there, and in those days the family doctor used to tell where to go. Now I think the concept itself is not there, and you
Yes,
think that it has a chance of revival because of AI.
definitely. I have done a course for family doctor also,
Okay.
uh, but unfortunately, the course got denotified or not licensed.
Oh.
But I feel just MBBS is enough. MBBS is enough license for doctors to practice.
Hmm. Okay.
Being a, it's all about mentality. I have seen in Bangalore, in where I was studying school. There, just a MBBS doctor is seeing more cases than any other specialty doctor. So that's because of the way they handle the patients and the way they treat, which
And
is
because of
now
their own curiosity also. It is because of their own curiosity also, right? They keep learning and updating. Although they may not go and do a PG, they may
yes.
continue to learn from books. Nice.
Basically, what is happening is the present generation of doctors, the seats are increased.
Okay.
So there is only one patient for 20 doctors in the medical colleges. So uh, some may be interested to talk to them, others are just standing, which I have seen myself. And may, we are doctors are not learning the disease process, how the disease happens, and how things are happening in reality, than because of the culture, or it could be the system. They are into exams and NEET and focusing more than then after that they come to practice. That time it is of not personalized to the patients, catering the patient needs.
The doctors have become soldiers. They are fighting the symptoms rather than treating the sickness.
Yes.
Good. Very insightful discussion, Srinidhi. I think a lot of things you have raised today, uh,
No,
especially
these
in
are
the.
the problems. This is my achievement for 10 years. I have seen the problems in root level.
Good, good. No, really. I think if many doctors will take this approach, and actually more with regard to the students, right? You have the opportunity of developing this skill of talking to the patient even when you're in college.
Yes,
It's in that way the medical curriculum or the pedagogy of the medical colleges is good, because the rest of it, all the other streams have completely lost touch with the industry or the customers they are intended to serve. At least in medical colleges, still you meet human beings, right?
yes, yes. No,
You have
slowly
the
I think
opportunity to
once
meet. Mm.
now AI simulation has come, AI patients are there. So the AI
Oh,
will act as a patient and doctors are trained like all these apps have come in US. I have
okay.
seen that.
Hmm. So there are apps where the doctor can go and practice, so they don't have to practice it on real human beings.
Yes, yes.
Right, right, right. Very interesting here. Very interesting. So any parting shot, any message that you want to leave for the rest of the world?
The rest of the world. It's a very big question actually. Uh, right now, a lot of problems are faced all over the world. Uh, War situation, everything. Maybe right now, even governments are falling. Today's news is that US government is closed. So we don't know what is going to happen. We have to protect ourselves and we should take care of ourselves. Don't expect someone else to. I mean, especially some people are thinking government will protect us, but we should be aware of our own problems and what we can problems we might encounter. We should be aware of it and try to be protected. We should protect ourselves. That's all is the
Hmm.
message.
Good. Thanks, Srinidhi. Thanks for such a
Thank you.
insightful podcast with us. I'm sure a lot of people are going to benefit out of this discussion, and I really look forward to see your venture grow and revolutionize the way medicine is being practiced. Hmm.
Thank you. Thank you, sir.
Thank you very much. All the best to you. Bye bye.
Thank you, sir. Bye, bye, bye.